สวัสดีค่ะ
สวัสดีครับ Welcome to NBT World's The Fireside. I'm Benjamin Ruchopagan.
And I'm Warisa Nilanat Gomon. Every week we have a fireside chat exploring what's happening in Thailand, diving deep into our latest obsessions.
So over the past few episodes, we've been looking at the legacy of Her Majesty, the late Queen Sirikit, the Queen Mother, from her cultural preservation of crafts to textiles to even her environmental stewardship. So today we're going to look at something interconnected but very different. It's just as foundational but not as visible. Enough teasing. This is about her public health legacy. So here in Thailand, I'm very thankful that we have universal health care and we have social security programs and social safety nets like the Gold Card in order to take care of people when they're down on their luck, or, you don't have to be rich in order to get medical attention and to get life-saving therapies. So I am very thankful for that. And I think that a lot of our attitude towards public health, I think we can attribute a lot of that to the grace of Her Majesty, the Queen.
Yeah, that's right. Not many countries have this, so we are quite blessed to have this.
That's right.
Now, long before Thailand had widespread healthcare access, digital records, or universal coverage, many communities, especially in rural and remote areas, had limited ways to receive medical care. And again, during royal visits across the country, Her Majesty encountered people who were sick, in pain, and struggling to access treatment. What followed wasn't symbolic concern, it was action. Immediate, sustained, and deeply personal. So she wasn't just traveling, leisurely. She really took account when she, met the people. She really talked to the people and wanted to understand what were some of their struggles. So
she wasn't just making royal visits and attending ceremonies, and she was actually connecting with her subjects, So in this episode, we're going to look at how Queen Sirikit responded to the realities on the ground, from bedside care during her royal visits to mobile medical units, humanitarian work through her work with the Thai Red Cross, and the institutions that continue to serve the public today. So let's begin.
So when we talk about public health today, we usually think about hospitals, insurance systems, or nationwide policies. But for a long time in Thailand, many people simply didn't even have access to any of that. During royal visits across the country, Her Majesty Queen Sirikit often encountered people who were seriously ill. And many had traveled long distances, sometimes for days, just to get a chance to see her. And when she saw their condition, she didn't treat it as symbolic or ceremonial. She responded immediately. Now, according to multiple documented accounts, Her Majesty instructed the accompanying royal physicians to examine and treat patients right there on site.
That's right. I mean, can you imagine you are traveling across the country and you're meeting with people who, are very thankful to be in your presence, even to get a royal audience with you, but they come from very difficult circumstances. You're leaving sort of the comforts of the royal capital, you're leaving the comforts of Bangkok or any of the major cities and going out into the sticks, to see how people really living, and discovering that, in the previous episode, we talked about degraded forest habitats, deforestation. We talked about how there's all these cultural traditions that are dying, and to understand that there's so many sick people who are in desperate need of medical intervention. So it suffice to say, she had a huge heart. And if someone needed continued care, right there and then, she ordered arrangements for admission to the nearest provincial hospital. And then, if the necessary treatment wasn't available locally at that hospital, patients were transferred to Bangkok to receive specialized care, with treatment continuing until their recovery, regardless of the cost or circumstances. And that was the breadth of her heart, really, in this situation. Over time, it became clear that the royal visits were moments of emergency healthcare for the communities that would be otherwise not have much access or have very limited access to medical services. So it ended up being that her visits were bringing the essential medical care that these people needed.
Right. And it's important to say this very carefully, that Her Majesty wasn't replacing the public health system. She was responding to real gaps that existed at the time and doing it with urgency and compassion.
So, we've talked about these royal visits for a long time, and it goes to show the value of them to actually be face to face with your constituents. If we turn things into in our current political system, it's very important for our representatives to interact and interface with the people that they're representing. And as mother to the nation, she really saw her subjects as family. And she never lost sight of the average person, which I think is very important. So as these encounters became more frequent, another challenge had emerged. There was just too many patients and too little time for the doctors that accompanied her to examine everyone during a single royal visit. I mean, if she's visiting, let's say generously, she's visiting once a year or a few times a year, people need now it's unthinkable to wait on a royal family member for medical intervention. It goes to show how much progress Thailand has made, in the intervening time. So, of course, when we reached this bottleneck of medical care during her visits, she ordered the deployment of the Royal Mobile Medical Units. Now, these are medical teams that would travel ahead of or alongside the royal visits to provide care directly to the rural and hard-to-reach areas, rural and remote areas.
Mm-hmm. And these units, they were led by Dr. Danai Sanit-wong, and and he also had support from ladies in waiting and staff from Her Majesty's household. And some of them were medicines that were prepared in advance. The dosages were carefully written on envelopes as well. Patients were organized into queues. Instructions were explained clearly so people understood how to take their medication once they returned home. And depending on the terrain, the teams traveled by car or even by helicopter. Now, the goal was simple: reach people where hospitals couldn't. I love how forward-thinking she was. Mm-hmm. Typically, I'll just speak for myself. If I find a problem that is a little bit hard, I'm not sure if I could think beyond then why don't we deploy medical teams and have systems to it as well. That's very clever of the whole system.
I think so too. I think that, she wasn't there to just solve the problem in front of her, and just she wasn't thinking out of sight, out of mind. Mm-hmm. She was thinking forward to the next royal visit, what are the problems that they're going to encounter, and what do the people really need, and whether or not it's sustainable for them to depend on these royal visits. So over time, as roads were built and rural public health services were expanded, the need for these dedicated mobile units were going to naturally decline, which is a good sign, really. Yeah. It's a good sign. But that doesn't mean that the care had stopped completely. Instead, Her Majesty adapted the approach, coordinating with provincial hospitals and public health offices so that doctors could arrive in advance and continue treatment before, during, and after the royal visits. So not just that, once she's done, then the doctors can just okay, well, I saw you, and then I'm done, I'm out. No, it was it was carried to its conclusion, trying to support them throughout the entire recovery process. So I think this is a really overlooked aspect of medicine, and it's a very unglamorous aspect of medicine, is rural medicine, because you can't really depend on advanced equipment, and you can't refer them to different specialists. You tend to have to become a generalist medical practitioner, and you have to be able to treat and diagnose a broad variety of diseases. Now we sort of take it for granted that, We'll go through screening, we'll go through ear, nose, and throat, and then we'll be referred to a specialist, and then we'll come back to a second appointment, a third appointment, or etc. But I think that, this field, unfortunately, it's because it's not necessarily the highest paying field, it's not as rewarding financially. And it really should be the opposite way around, in my opinion. I wish there were more general practitioners. And my grandfather was one as well. And he had to operate out of Chumpon. And, at the time, there were not that many medical practitioners. So it was like the whole town showed up to get diagnosed by him. And I think it's really important to support medical services and access to medical services in rural areas, because, we cannot divorce ourselves here in Bangkok from the rest of the country, So yeah, that's my 2 cents on that.
I totally agree with you. And what actually stands out most is that Her Majesty's concern didn't end when the visit was over, like you said. Patients who were transferred to hospitals in Bangkok under her patronage weren't forgotten. She remembered them, especially those in serious conditions, and regularly asked about their progress even. And she even instructed ladies in waiting and volunteers to visit these patients daily, not to supervise treatment per se, but to offer comfort, conversation, and emotional support. So it's, again, like a wholesome kind of approach that you're not only treating the symptom, because a lot of it is also psychological. It's also about emotional support. And, there's so many documents that say a patient heals better when they feel like they're being loved and taken care of.
I think it's so true, because like every time you get a cancer diagnosis, a doctor will know whether or not a patient has given up. They can sense whether or not this person's going to make it, whether or not they have the spirit to fight through it. And a big determinator of that, of the recovery process, of whether or not they're going to make it, is whether or not they have a support system. So I think that, and we've been through our share of medical, catastrophes and, our bouts of broken bones here and there, etc. And it's a very vulnerable time. It's a very hard thing to go through, even when it's a minor thing to you. Like maybe someone's been through something so much worse, and their road to recovery was so much worse than yours, or longer than yours. But even when you like I tore my ankle, right? And I could feel myself getting emotional at times, not knowing if I was going to get better, And I'm sure you've been through something similar. So I think it's very important that people find a way, you cannot undervalue these kinds of services. Like it sounds like, oh, they just showed up and they just kept them company. It's really way more than that, and it really shows that she really led heart first with her attention to the people, and yes, it was important to get them medical services, but it was also important to hold their hand through those services,
So we're going to talk about the Thai Red Cross. And while much of the Queen Sirikit's public health work began with direct personal care, it didn't stay at that scale, obviously. Over time, her humanitarian vision expanded through institutions, most notably the Thai Red Cross Society, where she served as president. Now, one of the most defining moments came in May 1979 when tens of thousands of Cambodian refugees fled across the border into Trat province, escaping conflict and violence. Now, faced with the scale of the humanitarian crisis, Her Majesty traveled to the area herself to assess conditions on the ground. Now, supplies, including milk, were prepared in advance and brought along with the royal convoy. During her visits, Her Majesty cared for many of the orphan children as well.
Yeah, it's interesting that, she was really true to her title as the Queen Mother, as the mother to the nation. And it wasn't just a one-off visit for the cameras. She was acting in her capacity as the president of the Thai Red Cross Society and established the Khao Lan Thai Red Cross Center. Now, as a base for humanitarian relief, The center included facilities for orphan care, for vocational training, a school, and staff accommodations. It was probably the most comprehensive, center of its kind of humanitarian relief, to think of not just the children who were orphaned from the political unrest in Cambodia, but also that they would eventually need training and upskilling, and that there would need to be education also involved. So there are also additional supplies at the center, including clean water, iodized salt, powdered milk, rice, clothing, plastic sheets, and electricity generators. And once the situation finally began to improve, the center could enter a new phase of social relief with her support foundation. So her support foundation, so true to its name, sent vocational teachers to share practical skills with the refugees. The Thai Red Cross Society Center at Khao Lan has continued to support the Cambodian refugees for over 7 years until 1986. And eventually things, finally calmed down in Cambodia by around 1991.
Right. And at the time, Her Majesty said, and I'm going to quote her in Thai here, ฉันตัดสินใจที่จะช่วยเหลือเพื่อนมนุษย์เหล่านี้เท่าที่กำลังความสามารถของฉันจะมี which translates into English as, I decided to help our fellow human beings to the best of my ability. Now today, the center is now known as the Rashakarun Center of the Thai Red Cross Society at Khao Lan, and it houses Her Majesty Queen Sirikit's commemorative museum dedicated to Her Majesty's compassion and generosity towards both Thais living near the border and Cambodian refugees. The center also serves as a training camp location for Red Cross youth, scouts, students, and university trainees. The nearby beach area has also been restored and opened as a recreational space for the public.
It's incredible, especially given, these troubling times with our neighbor, just this aspect of Thai history that I don't think gets talked enough about is how much the Queen Mother was, a proponent of humanitarian relief. And it's really been a through line in Thailand, how much Thailand supports humanitarian aid and humanitarian assistance. So I'm really proud to be, Thai because of this tradition of humanitarian aid. But beyond refugee assistance, the Thai Red Cross, under Her Majesty's leadership, has become a pillar of Thailand's broader public health infrastructure. Now, over the years, the government has assigned the Thai Red Cross Society responsibility for the National Blood Center, ensuring a stable and reliable blood supply for hospitals nationwide. So if you want to do something in appreciation for Her Majesty, the Queen Sirikit, the Queen Mother, then it would be great to, donate blood. So the organization has also, of course, played a critical role during natural disasters, mobilizing volunteers to pack and distribute relief supplies and provide medical assistance, as well as support the affected communities during times of great natural disasters. In these moments, the public health was immediate, it was logistical, and of course, deeply human, reflecting Her Majesty's grace.
And what is striking is how this work reinforced a long-standing principle in Queen Sirikit's approach to public health. And that care should reach people wherever they are, especially during moments of crisis.
Now, it's important to understand that, it's not just one-offs of, crises and disasters. This has been something that we feel to the present day, especially with the recent COVID-19 pandemic. During that pandemic age, from 2020 to 2023, I want to say, the Thai Red Cross Society became a key public health actor in something that affected the entire country at once, the entire world really. But here in Thailand, we're just going to focus on the national scope. Now, in coordination with national policy, the Red Cross Society joined Thailand's vaccination drive, actively encouraging people to get vaccinated as early as possible. I don't think there was as much vaccination skepticism as there is elsewhere. I think in Thailand, everybody, they just wanted to be safe. Of course, there were like cases here and there, like smaller isolated cases of some side effects here and there, but everyone understood their responsibility to herd immunity. So importantly, this effort extended beyond Thai nationals. Vaccines were provided free of charge to migrant workers, displaced persons who couldn't go back necessarily, who couldn't travel back to their own country, and other vulnerable groups living in Thailand. This reflects the government's stated principle of leaving no one behind. And so for me, it shows a lot of heart, but it also shows a lot of head. It's very smart to understand that, diseases, they're not confined to nationalities. They don't care whether or not you're a migrant worker or you're a citizen. It can infect you just the same. And it's in everybody's best interest at the time, especially, to get vaccinated and to build that herd immunity.
Yeah. And by May 2022, the Thai Red Cross Society had administered 1.8 million doses of COVID-19 vaccines, covering populations that might otherwise have faced barriers to access. But vaccination wasn't the only response, though. As livelihoods were disrupted and daily life became harder for families, Red Cross officials and volunteers also opened community kitchens across various provinces. These temporary kitchens distributed meals and essential supplies, helping to ease the economic and social strain of the pandemic.
Yeah, I mean, we think of these as services that are kind of ancillary or they're non-essential. But that's because we live here in Bangkok, where there's a 7-Eleven or a convenience store around every corner, and there's food delivery and grab bikes, etc. And so the food need wasn't nearly as critical as it might have been in rural Thailand, which is really important that she never lost sight of what's happening in the rest of the country. And now, beyond emergency care and mobile medical units, Queen Sirikit's public health legacy is also visible in the medical institutions that continue to serve the public today. Several major hospitals and medical centers were established under royal patronage, reflecting long-term investment in healthcare access and specialization. This includes the Queen Sirikit Center for Breast Cancer, which focuses on the diagnosis, treatment, and research related to breast cancer, and the Queen Sirikit National Institution of Child Health, commonly known as QSNICH. So both the mother and the child reflected in her healthcare legacy.
Mm-hmm. And some of the initiatives within that institute are the Mother's Milk Bank Support, infant nutrition, and maternal health, particularly for premature and medically vulnerable newborns. And these institutions play a critical role in Thailand's public health system and serve patients from across the country. Other facilities associated with her name include Somdet Pranang Chao Sirikit Hospital and the Queen Sirikit Heart Center of the Northeast, which contribute to regional healthcare capacity.
Yeah, and I just want to be exact here. These institutions were not necessarily founded by Her Majesty herself, but were established under royal patronage, or they were inspired by her sustained commitment to public health. We can really feel her legacy in every aspect of Thai life, from our hospitals to our farms to our art. So together, this represents a shift from short-term intervention to ad hoc intervention and relief to a sustained healthcare infrastructure. But also, public health for Queen Sirikit wasn't ever just confined to just the hospitals or the clinics or the relief centers. It was also about public participation and awareness. So one of the most visible expressions of this is the Thai Red Cross Fair, which everybody loves the Thai Red Cross Fair. Have you ever been to one?
I actually was there 3 days ago, and it's just as vibrant as it is every year. Now, typically, it's a little bit more vibrant, but this year I think because the occasion of her passing, it was mildly subdued. But I mean, you can feel people really coming together and, honoring her even there were musics and banners about her legacy, and that was all good. And yeah, it was a very fun fair.
Right. So they couldn't get crazy or they couldn't get hectic. Usually it's very festive, right? I love that in Thailand we turn everything into a festival, but also we know when to reel it in, for this respectful period. So together, the fair brings fundraising, public education, and health promotion all in one event. The proceeds from these fairs support medical services, disaster relief, humanitarian programs, which are all operated by the Thai Red Cross Society. And at the same time, the event serves as a space where people can engage directly with public health initiatives. They can learn about the medical services and contribute to national welfare. You can also learn some essential skills too, right? Like CPR and the AED, like resuscitation devices and things like that.
For sure. And now we turn it over to our audience. Have you ever encountered mobile medical units, Red Cross services, or community health programs connected to this legacy?
Let us know in the comments section of NBT World's online channels. You can find us on YouTube, Instagram, Facebook, and Spotify.
Thank you for watching, and we'll see you next time. สวัสดีค่ะ
สวัสดีครับ